How well do you think you have been informed about the CARE Act and its implementation in Harrow?
I am from the social services background and have been following the rules and regulations about community care. The Community Care Act 2014 came into being like a barat without band baja. It was sneaked in very quietly, and that is the act now.
Now, in terms of Harrow, has there been any engagement with the community?
Okay, let me first take you back to the main points of the act. The local authority, whether it's Harrow or any other local authority, is obliged to promote an individual's well-being. When I say individual's well-being is looking after personal dignity of individual and treating them with respect. Physical and mental health and emotional well-being of individual should be paramount. Protecting them from abuse or neglect. The control of individuals' day-to-day life and the care plus support should be done with their consent or them being able to dictate what they would like to have.
And is that something which is happening?
The local authority, that is Harrow Council, has initiated this, but there hasn't been the publicity that one would like to see. We at Sangat have been providing information, guidance, support and casework for many, many years. But to date, not a single approach has been met by the council to get our views or the community's views or establish community links.
You said about safeguarding adults. In Harrow, what has been reported is that there have been 854 cases of adult abuse in the last 16 months, while council is paying for the same period £49 million for social care. Does that surprise you?
It doesn't surprise me because I have worked for Harrow Council in the past and these things are not new to me. I would add here, there are a lot of people who, due to language barrier or other reasons, don't report their abuses. So it would amount to thousands.
Regarding safeguarding adults in social care, has there been any awareness by the council regarding this particular aspect?
Awareness amongst the people hasn't been well publicized. There are a lot of people who would fall in the category, but the council, because it would be an expensive exercise for the council hasn't really gone to town on it.
What is your understanding about the quality and the training and again awareness amongst the carers?
Whenever you find a squeeze on the council from the central government, training is the first thing they would cut. So I am not aware of heavy training given in this particular field to social workers or community workers.
Now, there are some people who would say that when assessment takes place, it's normally a procedure of tick box, rather than looking deeply into the real needs of the people and also their background and the sort of things which you raised initially. Is that also your understanding?
What the social worker or assessor should be doing is allowing individuals full participation in decision relating to him or her, and then achieve a balance between the individual's well-being and that of the relatives as well. This needs to be, people need to be protected from abuse and neglect.
once the assessment is done and there are evaluation of people's welfare and care needs, what about the provision? Do the people are provided for their needs?
Unfortunately, it doesn't match according to people's need, but the council must establish and maintain a service for providing people in its locality with information, advice and support. They can charge people for the services they provide, but it should be done.
What do you know or hear about the experience of welfare and social care service users?
Service users are a bit naive in this area because they haven't heard of this. The council hasn't gone out to publicize the act and their responsibility. They have a duty to inform the public, to inform the community, go out and talk about it, particularly to elderly groups or to the groups who care for children who are disabled. The council has to be seen to be doing this, and the council has failed in this area.